patient is a good candidate for a male sling if the bladder is able to store urine, if the urethra is intact, and if the patient is able to control urination, to stop urination during voiding. A patient also has to have minimal to moderate stress urinary incontinence. In other words, using 1 to 2 pads a day are really ideal candidates for the male sling. The male sling is a well-established procedure. It is covered by most commercial insurance, including Medicare and Medicaid. There are essentially 2 types of male slings available in the United States. Coloplast makes a sling which has 4 arms of attachment. Boston Scientific American Medical Center makes a sling that only has 2 arms. All of these devices are extremely successful. The male sling is made of a mesh-like material, very similar to the mesh that is used to repair hernia, for example. So it's something that is very safe and something that has been used for over 30 years in the human body. The male sling procedure is a minimally invasive procedure. It's performed on an outpatient basis. A small incision or opening is made in the perineum. This is the part of the body that is behind the testicle in front of the anus. Through this opening, the sling is then inserted with long needles and no other incisions are necessary. What's great about a male sling is that there are no moving parts. What the sling does is reposition the urethra inside the body. It actually creates a little S in the urethra, mimicking the prostate, increases the resistance to outflow. So it really is a very clever invention and is ideal for patients with minimal to moderate stress urinary incontinence. Since there are no moving parts, the male sling can last for many, many years. We've had patients with slings for over 10 years. So it's something that is very durable. There are no malfunction that occur over time. If a sling works in the beginning, it will usually work for many, many years. Male slings are very effective. There are many peer-reviewed publications in the urological literature that document that these devices work. Again, preparing patients' expectations is important. If we have patients that have moderately to severe incontinence, some of these patients may also benefit from a sling. It reduces the level of incontinence. If we take a patient that uses 5-6 diapers a day to 1 diaper a day, that patient may be incontinent. However, we're able to improve quality of life. So these devices are very effective, and there is very good documentation in the literature of their effectiveness. The male sling is a very safe procedure. If the mesh is too tight, and that is something that is learned by experience, then patients may have difficulty urinating after the procedure. They may need a catheter temporarily. Very rarely they will need to catheterize themselves for a few weeks after the procedure. In general, because the incision is so small, there's no bleeding, there's no infection, there's minimal amount of discomfort and pain. Patients report improvement, their incontinence the day after it's placed, since there's no moving parts, nothing to activate like an artificial urinary sphincter.